Doc on the Run. We help injured runners run.
If you're a runner and you have pain in the big toe joint, the first step in treating it is figuring out what is actually causing the problem. There are lots of different causes of pain in the big toe joint, but there are really 5 that are the most common that I see in runners. So I'm going to explain those to you real quick. The first thing is turf toe. Now, turf toe is an injury to the big toe joint where you basically damage the joint capsule surrounding the big toe joint. Now, this is usually something that you get with a sudden traumatic injury. You know, it's the term turf toe actually comes from astroturf, or playing football on artificial turf, where you can actually really jam the toe and get a lot of force through the toe, and it damages the joint capsule and causes an injury. That's really unusual in runners to get that kind of injury. I've seen it a couple of times in triathletes who've gotten it where they've kicked somebody during the swim, but it's rare by comparison. But if you get it, it really hurts when you move the big toe in pretty much any direction, but it's hard to pinpoint exactly where it hurts, but it does hurt when you move the big toe joint, and it's usually swollen and really achy, and it starts with a really sudden onset. So that's one of the keys. Now, the second thing is a sesamoid injury. Now, sesamoid injuries are injury to these 2 little bones that sit under the big toe joint, and they're basically like tiny little kneecaps, but they're sitting under the big toe joint. They're about the size of kidney beans, and if you get too much pressure, too much irritation to one of those bones, you can develop inflammation in the bone, which we call sesamoiditis. If you apply pressure to it, stress to it, whatever, too much over and over and over by the way that your running form is or whatever, you can get an actual sesamoid stress fracture. That's much more serious. And if you really damage it, you can actually get a true sesamoid fracture, and that's a terrible thing. But that pain is very specifically on the bottom of the big toe joint, and you can usually find the specific spot where it hurts. So if you push around on the bottom of the big toe joint and you find one spot where it hurts way more than another, and that's the spot where that particular sesamoid bone is, then you can tell that it's sesamoiditis. But you have to think about this, because sesamoid injuries, if you think you have that, you need to take it really seriously, because that's a risky thing for runners. You do not want to ignore a sesamoid injury and just keep running on it, making it worse. So if it's hurting when you run, you need to figure out what's going on first. The next thing is gout. Now, gout is a thing that I get runners all the time that will say, I think I have gout because I have pain in my big toe joints. I think it's just that there's so much stuff written online about gout and about how you get, these uric acid crystals in the joint. But the truth is it's very rare for athletes. I've only seen this a few times in athletes. And in those cases, they're people who've gotten severely dehydrated. So they're probably prone to getting gout. But then because they lose so much water in their system to dehydration during a race or during training, their relative concentration of the uric acid in the blood goes up, and they get an attack of gout. But gout is pretty unmistakable. It's extremely painful. It starts relatively suddenly, usually when you're dehydrated or you've eaten some huge meal that's high in protein meat. It's very rapid onset, and it's excruciatingly painful. The classic description is that people will say it hurts so much that they can't even sit in bed because the bed sheets hurt when they touch it. It's bright red, it's really swollen, it is supremely inflamed, and it's not really easy to confuse it with the other conditions. Now, the next thing is bunions. So bunion deformity is one of the most common things that podiatrists treat, but it's pretty obvious when you have it. Your big toe is changing position, it's drifting over, the bone, the first metatarsal bone at the base of the big toe joint, is sticking out in the other direction, and it gets red and irritated when you rub it the wrong way in shoes. It can really flare up too. Some people say my bunion got way worse overnight. Well, that's not true. If your bunion got way worse overnight, the bunion or the positioning of the bone didn't really change, but the bursa overlying the bone got irritated and it swelled up, and it makes it look way worse. Sometimes people mistake that for gout just because it is bright and red right where the bursa is irritated, but it's a completely different condition. And the fifth thing is hallux rigidus or hallux limitus. They're basically the same condition, they're just different names for the same condition. Hallux means big toe, rigid obviously means it's stiff, and limitus means that it's limited or it doesn't move as much. So the hallux rigidus or hallux limitus, this is basically the opposite of a bunion deformity. It's the thing where you get stiffness and limited range of motion in the joint, and then because it's limited, when you move the big toe joint, you're actually jamming the cartilage, irritating the cartilage, and in some cases, lining the inside of the joint or the synovial tissue in the joint, and it becomes painful. Now, that's pretty easy to calm down, and it's not too difficult to get it to calm down to the place that you can run with it. I actually have that condition myself, and I still run a lot. So I do lots of things to make sure I don't irritate the joint doing other exercises, But not all of these conditions mean you have to stop running. There's a whole range of conditions in the big toe joint, but you have to figure out which one of these is most likely to be causing your pain to decide whether or not you should stop running or whether or not you can keep running and get it to calm down while you're still running. You just have to make sure you know which one is causing the problem to figure out if you can keep running.
Doc on the Run. We help injured runners run.